David, how do you feel?
Very comfortable.
Wonderful. For doctors watching, you're seeing this very complex case of arcadal keratotomy with transplant. Visibility is extremely poor. We have already worked on a very complex posterior corneal or posterior polar lenticule, and now being very fastidious about putting the lens on a correct axis. And the patient, as usual, has no IV sedation. Right, Dave?
No,
He's a wonderful chiropractor. David, how would you describe your experience here?
Very relaxing. The staff makes you feel very comfortable.
Wonderful. I'm inside your eye right now in this very complex eye. Doctors, you can see my visibility is extremely poor. I'm sitting with my hands on one side and back on the other. And David, how's your comfort without any anesthesia, any IV sedation, just numbing?
Yes, I'm very comfortable. There's no pain with the procedure.
Perfect. So you can see this multiple over 20 card RK. You can see right here in the central transplant. Visibility is poor, but we are being very fastidious. We already finished the surgery. You're seeing the lens now going on axis exactly as is here. And David's wonderful chiropractor. David, are you comfortable?
Yes, I am very comfortable.
Doing very well. Congratulations. Okay, so now it's the great fun coming out. The media. So you can see here multiple over 20 card RK, a transplant with residual sutures, very high regular astigmatism. We are able to remove the posterior polar lens, put in a premium technology with the axis. You can see here the dots matching the mark on the cornea, and taking those stitches, we have ingeniously hydrated his incisions. And here, very important, look down here, we actually went through his previous extensive LRI, limbal relaxing incision between the AKs, and used that disadvantage to our advantage and entered there. And you can see here, completely sealed. David, are you comfortable?
Yes, I am.
Super. See here as I'm testing, incision is nicely sealed. And look down. And you can see the parasite pieces I went through. The LRI is also nicely sealed, that is completely dry. And you can see the stability of the chamber. We're very proud of you. Drop, please. David, you're all done. How do you feel?
I feel fantastic. Thank you for having the courage to help RK patients like myself. You have given me the fountain of youth, so I really appreciate it.
How was the feeling during surgery? David, for doctors who are watching, you saw this case?
The surgery itself was pain-free with just using the numbing drops. And being a cornea transplant patient, I can appreciate not being under any anesthesia. And I really, really, really appreciate that.
For doctors who are watching, amazing. All my patients are amazing. David's another amazing patient from Atlanta. He's in the medical profession himself. And he has had a full thickness transplant on top of his over 20 cut radial keratotomy incisions, along with limbal relaxing, very large cuts along the periphery. So it became very difficult. How do we even enter this eye? And my desire for no stitches, remember? So we went in, we actually played through his LRIs and went through his RK area in the periphery, no scleral tunnel and excessive pain through the cornea. And then the visibility was so difficult because of the deep chamber, and we've gone in and removed his polar cataract and put in a premium toric lens on the axis as best as you can see with a two-hand toric technique. And then we took no stitches. You saw my hydration technique there. And here he is. No IV sedation. There is no anesthesia, drops. David, anything you want to say of your experience, given your IQ and your knowledge before traveling here?
I'm just really grateful that you have the courage to help patients like myself. Thank you.
Pleasure, absolute pleasure. All right, David, all done.
Congrats!
How do you feel?
I feel fantastic. I'm very grateful that Dr. Gulani pretty much gave me a new lease on my eyes. I was turned away by every other ophthalmologist that I visited, and they said that there was absolutely nothing they can do until I reached my full potential of cataracts. And so I really appreciate Dr. Gulani's passion that he brings to the field of ophthalmology and to all the RK patients, because we need him in our corner. There's nobody else that's fighting for us. So thank you, Dr. Gulani.
Congratulations. Get some rest in the
Yeah,
now,
will
please.
do.
I'll see you.
Okay, bye.
Careful, please. Careful with your eyes. Oh, wait. Careful. All right, here he is, Dave. All done? How do you
Yes,
feel?
I feel fantastic. I'm just very happy I came to Jacksonville and had the experience to meet Dr. Gulani and his wonderful supportive staff. I mean, they make our life so much easier.
Been a pleasure, man.
Thank you, sir.
You take care of patients and been a real honor. You guys being complex, that's not your problem, it's my responsibility. And for doctors watching, this amazing guy takes care of patients himself in Atlanta, right?
Yes.
And came with unbelievable complexities, irregular corneas, transplant over his 24 cut RK with limbal incisions. And we just removed his early cataract out of that. No stitches, no drugs, you're walking out, ready to roll.
Amazing. Amazing. Thank you, thank you. I was gonna say, I'm gonna end with God answered my prayers. No doubt.
Absolutely agree. Absolutely, absolutely agree. Yes. David, good morning. How are you?
Good morning, sir. I'm doing very well, thank you.
Fantastic, man. I've seen your vision.
Yes, just a little bit about myself. I mean, David Henline, I'm a chiropractor from Atlanta, Georgia. A little bit about my history is I had RK back in 1989, 24 cuts, 2 cornea transplants, and I was told by every ophthalmologist that they could not help me. So therefore, all roads led me to Dr. Gulani here in Jacksonville, Florida. And truthfully, here I am the day after. Vision before in my right eye was approximately 22,000. And this morning my vision was checked, and obviously my right eye is still healing with the RLE. My vision is 20/60. That in itself is a miracle. So for me sitting here in this chair with Dr. Gulani and his staff, it really is, it's a culmination of 1,000 prayers on top of 1,000 prayers, which are answered in this office. I mean, I am, and this office is a miracle, and I am truly grateful from the bottom of my heart.
Well, David, you made it into a testimonial. I do this more to inspire and encourage my colleagues worldwide, and I will share with them. Again, amazing patient, like all my patients. This is day 1 of his surgery.
Day 1.
And we did LenzOplastique, which is we went inside his eye. If you can see here, should I turn the lights on for him? If you can see here, this is how he presented over 24 cut RK. You can see here. And a full thickness transplant in the middle. And the only place between the RK had a full deep limbal relaxing incision here. So I couldn't enter. But I still did not take the easy way out and make a scleral tunnel or take a stitch. We still went under the radial keratotomy scars, performed this very difficult LenzOplastique, which was like a lens exchange surgery where we removed his old lens, despite him being very highly myopic, very deep chambers. So visibility was an issue. Looking through his transplant, through the RK, in an area where it goes beyond the microscope focus. And all this without anesthesia.
Without anesthesia, only numbing drops.
Numbing drops. Any pain during surgery?
There was absolutely no pain.
And then what I did is I uniquely ended the surgery by hydrating the way I do in my Vanguard technique into the RK incision. And that's what sealed it so you cannot see, and today's day 1. And we put a toric premium lens platform for him to cancel the optical aberrations of the RK cornea, which was over 15 to 18 diopters anterior posterior irregular astigmatism. And here he is today, 20/60 unaided, still dilated from yesterday, and 20/40 corrected. And I'm going to see him again before he travels back to Atlanta. This is his pre-op, you can see, and this is his immediate post-op today. You can see, you cannot tell where I entered right here. I in fact use this limbal full thickness incision to make my paracentesis through it, and then I used it as a fulcrum and entered through under the RKs here. No scleral tunnel, there are no stitches, there was no anesthesia. Would you describe any pain during your surgery? How was your experience in my surgical suite here, David?
The surgical suite was very relaxing, and there was absolutely 0 pain during the procedure.
Super. And how do you feel right now, day 1?
I'm ecstatic and over the moon that I can see 20/60. I know as the healing process continues, I know the vision's going to get better, and it's a miracle. I mean, it is all of my prayers answered. So thank you.
Absolute pleasure. Absolute. Thank you for your trust. I'd like all my patients that are seeing doctors and industry, but they all watch every day in my institute. They are so knowledgeable before they come here. He could quote my lectures I've given to doctors. Forget reading about my things that I write for industry and explaining my concept. Right, David? You've looked at everything before coming
I've
over.
done all the research.
Like all my patients. So it's an honor. Even now I still have the other eye to perform on, but give me a break.
Yes, sir.
Get back to the hotel.
Yeah.
Very proud of you.
Thank you.
Super. So here we are, if you can see in this technology, we have actually broken down the elements of his eyeball like a camera and seeing how his viewfinder sees, how his lens sees, and how the film of the camera is seeing. And we took this gentleman, an amazingly high IQ gentleman, he's a chiropractor, and himself has done extensive research, David, right?
Yes, sir.
Read a lot, understood everything. In fact, I call these the new breed of patients after COVID. Because not only have they read about my work, they have listened to my lectures to other doctors, right, David?
Yes, all of
Yes? And what did you find in those lectures?
that you are the current Da Vinci of ophthalmology, and you step up to the plate and give RK patients hope.
Sure. And what this technology, among the first in the world that we have acquired, is showing me how David reacts to vision. And what we did in his case, he had multiple previous surgical complications, radial keratotomy, 24 cuts, with circumferential limbal relaxing incisions, which is a full cut around the cornea, then a full thickness transplant on top of that, a deep chamber, extreme astigmatism, extreme nearsightedness, and cataract. And we did his surgery without stitches,
Without stitches.
without injections. And we were chatting as I was in his eye, and today he's leaving with 20/40 vision without glasses, which is better than 20/20 in his case. And the confidence that he's actually driving
Yes, sir.
back to
I
North
mean,
Carolina.
You've just kind of given me my freedom back. So yes, at day 6, I'm seeing 20/40 and driving back to North Carolina to see my daughter.
And after how many years of blindness?
I had RK back in 1989, so it's been a little
30?
nightmare for 30 years.
30 years. That's the story of David.